Year after USAID was closed by the Trump administration, many are still navigating the fallout. Some former workers of the agency are still without a job, and organizations that relied on USAID funding are now facing new realities. I spent the last year investigating the fallout. I recently traveled to Port Elizabeth, South Africa, to see firsthand how an organization that depended on USAID funding to combat tuberculosis has been able to move forward and still care for those in need. With the support from the Pulitzer Center, here's the second installment in my exclusive series, Aid Interrupted.
We are going to initiate TPT in a community setting. Usually TPT is initiated in a clinic, but because of the congestion of patients, sometimes patients don't want to come. So what we do, our professional nurses get medication from the department and then they do initiations at the households.
That's Refiwe Mototo. She runs the ground operations for the Orem Institute's Pro-TB program. She, along with nurses and other professionals, goes door to door testing and providing treatment for tuberculosis or TB.
Today we are coming just to assess them and initiate them on TPT. So here I have medication. As you can see, there's a different regimen for the children, which is INH. Also, I have a HIV test here.
South Africa is among the World Health Organization's high-burden countries for TB, HIV-related TB, and drug-resistant TB. Tuberculosis is a serious infectious disease that usually spreads from an infected person by coughing or sneezing. It is curable, but if left untreated, can be deadly. Tuberculosis is a leading cause of death in South Africa. Experts say it is prevalent because of poverty, crowded living conditions, and HIV infection.
So the lady, she has a hearing problem, but the husband will be speaking to her directly, or we have to speak a little bit louder so that she can hear. And then they've taken history, the lady's on ART medication.
For this Sarah Bartman family, the male partner is positive for HIV and TB, and his female partner is HIV positive and TB negative. Although she's testing negative for TB now, she's been exposed, and the Pro-TB team is giving her preventative treatment to ensure she remains negative.
Now they're gonna make sure that she also stays on TPT until she finishes, but ART, she'll be on ART for life.
In 2023, USAID awarded the Orem Institute a $47 million grant over 4 years to research, track, treat, and prevent TB in 7 provinces in South Africa, referred to as high-burden areas because of the prevalence of TB cases. But the work came to an abrupt halt in 2025, a short time after President Trump was sworn into office. Dr. Priyashni Subrayan is Orem's technical director for TB.
You know, apart from being completely shattered and heartbroken about the work that we were producing, we had to kind of pick ourselves up quickly and try and figure out, what do we do next?
The Trump administration canceled 83% of USAID contracts. Secretary of State Marco Rubio alleged in an X post that the agency spent tens of billions of dollars in ways that did not serve and in some cases even harmed the core national interests of the United States. Dr. Subriam said Orem's Accelerate One program used their USAID funds appropriately and said there was regular oversight from USAID officials.
USAID was very strict about, how you use your funding and how they monitor you, and then how regularly they come and visit you so that they can see you doing the work.
The Trump administration has what it calls an America First global health strategy. According to a spokesperson with the State Department, the goal is to have clearer strategic direction, stronger accountability, greater recipient country ownership, and a sharper focus on results.
They've identified more than 60 TB cases now.
The USAID funding cut meant that Orem was forced to lay off workers directing the Accelerate One program and temporarily abandon its efforts to fight TB. It left thousands untreated and without monitoring for months. But help did eventually come in the form of a $1 million anonymous donation.
And we're not serving, within facilities like Department of Health. We're really going to the people who don't go to facilities.
That anonymous gift allowed Orem to restart its TB work in February, but instead of serving 7 provinces, they can now only afford to serve 2. Orem can only rehire a handful of its workers it laid off as well. With limited funding, staff look for cost savings wherever they can. They collaborate with other organizations, and they run only 2 of their 3 mobile X-ray vans where they scan lungs for signs of TB to save on staffing and fuel costs. I also traveled with the team to Soweto. This man said he felt congestion in his chest. It got so bad he was forced to sleep on his side. He stopped by the van to get checked out.
What does it mean to have something like this come to your community?
He's very much happy for this because now Monday he has to go to the clinic and then to meet with the doctor for the interpretation of the results.
We've identified a lot of cases and we're able to put them on medication, but we still need more resources to make sure the spread is kept.
There's a sort of a devastation that the funding that you once had is gone, but there also does seem to be a relief too, that you have a bit more freedom in ways that you didn't have, and that because of that you can be almost a bit more innovative too.
Yeah, to come to think of it, you are right. I mean, they always say, don't let a good crisis go to waste, right? And what this has clearly taught us is that if you only have this amount of funds, right, and it's limited, how do you maximize every single, dollar or cent to make this project last as much?
So minimize.
While they focus on the work, they remain hopeful for the future. The grant ends at the end of this year, and while no official determination has been made about an extension, they hope someone will step up to keep their community-based TV program going. You can see more of my reporting streaming right now on WUSA 9. All 3 parts, including new interviews and extended conversations with experts on the future of global health. You can watch it all on WUSA 9.